There it goes. Okay, welcome everyone. My name is Karin Duncan. I'm a physician here at Coeur d'Alene Healing Arts in Coeur d'Alene, Idaho. And I am hosting an open forum today based on the autonomic nervous system as described and taught by the polyvagal theory. Has anyone heard of the polyvagal theory before? You can raise your hands, you can nod. For those of you who don't want to turn your video on, that's fine. I do recommend that you use the little raise hand button on the bottom of your screen. There you go. Good job. To signify if you have a question, if you have a comment, or if I ask a question, you can raise your hand if yes, and then you can take your hand down. Also, the chat box is over here. You can send a message to everyone, or you can send it just to me. I'm going to see them as they flow through. So feel free to use that chat box if you have questions that you don't want to say out loud. Again, not a HIPAA compliant video, but if you want to turn on your videos and your microphones to be more participatory, that is welcome and encouraged. We are already recording this video for later viewing purposes. So the autonomic nervous system, some of you raised your hand saying that you've heard of that before, the polyvagal theory coined by Stephen Porges. And really what he did was break down the nervous system in a way that I feel is understandable from a human experience. How do we orient to our surroundings? What do we know is safety? How do we recognize if we feel safe? How do we recognize if we don't feel safe? And safety, oftentimes in my practice, and when I start to bring up safety, there'll almost be a physical recoil from people. I'm safe. Safety is a little extreme to use here, doc. And safety is less about, boo, I'm in danger, or what's coming around the corner, and more or less how your nervous system is orienting to your surroundings. And when we learn a little bit more through the lecture today, I think you'll start to understand, it's more this subconscious identification of what's in my environment that's creating these physiologic responses that I might not even be aware of yet. And then the hope is by the end of the lecture today, we can start a practice of becoming more aware to what our body and our nervous system is trying to signal us in that never-ending, really, communication strategy. So with that being said, I am going to go off a PowerPoint today. I like to say it's definition heavy today. We're going through a lot of definitions about the nervous system, but in an effort to do that, what we're going to see is how we can piece that all together. So somebody who's not muted or mic'd or can raise their hand, can you see this okay? It's got a big purple brain and some electrical circuits. And
Yep.
Good. I like it. All right, so let's start with what is the nervous system in general, right? We're supposed to be focusing on the autonomic nervous system today, but what is the nervous system? Most people don't know that there's multiple components to our human nervous system. We have the central nervous system, which is your brain and spinal cord, and this is responsible for receiving, processing, and responding to sensory information. We then have our peripheral nervous system, which is the sensory information, right? That's out there in the periphery saying, hey, I'm going to communicate from the central nervous system to the rest of the body. And that's broken into two different parts. That's the somatic nervous system, which is your nerves that go to your skin and your muscles. So your vibratory sensation, your pain, your heat and temperature. And then that's conscious activity. I want to move my finger here. I want to touch this. And it's really conscious interaction between the world and your central nervous system. And then we have your autonomic nervous system. And that's what we're really focusing on today. I love this video. This is a stained dye of a neuronal pathway in our system. And I just think if you're a geek like me, it's pretty much the most beautiful thing you've ever seen in your life. And this is happening in our bodies all the time. And those little green tendrils or dendrites that are reaching out, to each other to create these synapses and communicate with each other. This is a never-ending ebb and flow of how our nervous system works, and really the theory behind neuroplasticity that we can talk about. Can we create new neuronal pathways? Can we reorient how our nervous system exists? And again, by the end of today, I'm hoping that you're leaving with the resounding absolutely. So in the autonomic nervous system breakdown, this is really historically defined as it's a regulatory system of the internal organs without conscious awareness. And the autonomic nervous system then is broken into two pieces. We have our sympathetic piece and our parasympathetic piece. And our sympathetic nervous system of the autonomic branch increases the blood flow throughout the body to promote metabolic needs of movement. So in a simplistic way, we've all heard the term fight or flight, right? We're getting chased by the saber-toothed tiger. We need that sympathetic nervous system tone to kick on. We need the blood to flow to our muscles. We need our eyes to dilate so we can take in a bigger sight picture. We need our heart to pump. We need our lungs to expand. And we move into this mobilized behavior of defense. And again, that's that fight or flight. Interestingly enough, I had a consult with a psychologist, and he said, well, you know, and I was teaching him about the polyvagal theory, and he turned around and then taught me more on a psychological level. There's more F's to our fight or flight system. And we know the freeze and fawn physiologically, and freeze is that deer in the headlights. I have a million places that I need to go to not get hit by this car, but I think I'm just going to stand here because I'm paralyzed with the sympathetic response. The fawn is really that people-pleasing mentality. I'm so overwhelmed and overstimulated that I'm just going to do everything just to settle down the environment around me. And that's more of an adaptive response, I think, over time. And then fornicate and food are also two F's that come in that stress response time. And some people's libido can change to either be higher or lower in times of distress. And then some people either turn towards food or they actually become anorexic or avoid food when they're in a time of stress. So those are some other things to really be aware of, that when we are in a sympathetic state of being, those are other parts of our physiology that can be affected. The other part of the autonomic nervous system is the parasympathetic, and that's the tone in which we are supporting health and growth and restoration. Again, the rest and digest, restore and heal. And now even that parasympathetic tone can come with some different ways of being, and we're going to dive into that a little bit. And that's feigning death, right? That's your possum. We're just, I'm so scared, I'm going to pretend like I'm dead. Immobilization, where we really can't function, we can't get our physiology to move up, and that can actually lead to certain states of being, especially in the cardiovascular system, where we're dropping down in our heart rate, or dissociation, where we're not even identifying with what is really happening in our world, where we're really become detached from that. Go ahead, Rich, you have a question?
Yeah, what did you mean by fawn, F-A-W-N?
FAWN is that kind of people-pleasing mentality, is how can I, in my stress state of being, how can I manage control over my environment so nothing else will go wrong? So it's really that trying to appease everything. I always kind of joke with my patients that if you're face-to-face with a bear and you're in a fawn state of response, you're going to try to pet it. Like, oh, it's okay. Maybe you just need a cookie, right? Like what? And then if you put it in actual terms, what I see people respond to is, this is mostly like in a familial setting, right? You'll have a child who went through extreme abuse as a child, and then as an adult with maybe a slightly verbally abusive partner or sibling, they really don't respond, right? It's a stress state of being, but I'm gonna be whoever you want me to be to make you not upset. So it's an adjustment, but it's a stress-induced way of existing with your nervous system. Does that make sense? Or to help answer the question anyway?
Yeah, that's fine. Thank you.
Okay. Adrian, go ahead.
On the freezing, does that also refer to freezing like gait with a Parkinson's person?
There are theories that the freezing of
Connection?
gait. So the gait station, the freezing of gait and station with Parkinson's disease, if you're not aware yet, that is my specialty in practice, can be associated with the nervous system dysregulation. And this lecture series actually that I'm sharing with you today is an abbreviated version of one that I did at a Hope Parkinson's conference, where I then take all of this information and apply it to the symptoms of Parkinson's disease and how vagal nerve dysfunction and dysautonomia is really affecting a lot of those symptoms. Freezing of gait is still idiopathic, as far as we're not really sure why that happens, because it can happen in the on or off stage of Parkinson's disease. And also for the majority of my patients, I am noticing that there is some sort of stress induction involved in there, whether it's just a doorway, an unfamiliar area, going into a place that can be triggering or whatnot. But I see a definite correlation there.
Thank you.
Of course. Within the autonomic nervous system, just a quick glimpse into this because it's so important. My 4-year-old son will tell people, what does your mom do for a living? He doesn't ever say I'm a doctor. He says, she talks about brains and poop. And really I do. And so the enteric nervous system is an entirely different part or subsect of our nervous system that's a mesh-like system of neurons that govern the function of the gastrointestinal system. And so this runs from our esophagus to our anus, and it receives innervation from our autonomic nervous system via the vagus nerve. And so when we talk about malabsorption, indigestion, constipation, really anything you can think of in the digestive tract that might be out of function, we have to take into account which nervous system tone are you in? Are you in fight or flight, or are you in rest and digest? It's right there in the name. But what we're missing most often is we talk about rest and digest being nature of the parasympathetic nervous system, but then that parasympathetic nervous system governed by the vagus nerve has to stimulate the enteric nervous system then to do its job. So there's a whole extra step in there that's involved in proper digestive function. So that leads us to the vagus nerve. What is the vagus nerve? We're not going to Las Vegas. This is a different spelling, although it's Latin for the wandering nerve. It is the longest nerve in the human body, and it runs from your brainstem, like I said, all the way through the viscera and down to the anus. It is the primary nerve in the parasympathetic nervous system. So the branch of the autonomic nervous system, and it's connecting that brainstem with all the viscera. So you can see here in the picture, it's just a brilliant, beautiful picture, all of the different visceral organs that are innervated or stimulated by that vagus nerve. So the importance of this, why is it so important? As a neurologic practitioner, somebody who talks about the brain and poop all day long, according to my son, is, I went into neurology because I really wanted to understand the brain. I wanted to dissect the brain. I wanted to heal the brain. And what I've learned over time in my practice is really the brain is the motherboard, right? The brain is there and it's responsible for a lot, but it really isn't at fault for a lot. And that's a big difference, is it's responsible for making sure your body is responding to its cues appropriately, but it has to receive information and how to guide it, right? It's really, it's a pilot without a navigator. It has to get that navigator to say, oh, we need to go west to get to this waypoint, and then it's going to move the controls and turn the plane where it needs to go. But 80% of the vagal fibers, so on that vagus nerve, are afferent, which means 80% of the fibers of that parasympathetic derived nerve are coming from the body, mostly the heart, to give the brain information. And so we're not blaming the brain for how we are in the world, right? The brain is literally receiving information from the periphery saying, okay, we don't feel great. We don't feel safe. Let's go into a different mode of being. Go ahead, Rich.
You know how you could say that muscles are one way as a way of describing them, where they move the hand to the right, a muscle moves. When you move it to the left, a different muscle contracts. So do you understand what I mean by that analogy?
No, try that again on me.
Muscles are one way.
Yes.
They contract a joint, but they don't extend a joint. It's a different muscle that contracts it to move to the other side. So
right.
In that regard, that we know that muscles are one way, are nerves in the nervous system generally one way?
Absolutely. Yeah, we have our afferent, which comes from the body to the brain, and we have our efferent, which come from the brain out. And so the nerves also work one way. The signal goes one direction, unilateral. And when we have a nerve or a complex of nerves, it's a highway system, and they're going in and out, in and out, in and out. And that constellation of how they communicate creates whatever output we're getting. The fascinating part about this that I'm trying to get across is that while we want to say, hey, brain, we're safe, I'm going to logic and reason you into thinking that we're safe, right? We want to have all this brain power control, willpower. We talk about all these different things that we need to do to control our brain. When 80% of how we're experiencing the world is our brain responding to what our body's telling it to do. And so now we're saying, we're going to get to it in the last slide, but is this really automatic? Right? How much power do we really have over which state of being we're in? And that's the whole point of the polyvagal theory. So that's literally what gets me so excited. So the polyvagal theory coined by Dr. Stephen Porges is really focusing on that vagus nerve, and that vagus nerve, like Rich alluded to, has the dorsal and ventral area, so that even one nerve is broken into multiple different sects. And it's the autonomic balance between the sympathetic and parasympathetic way of being. And then I want to talk about the vagal brake in a coming slide and just explain to you what that means and why we're talking about that. But you can see that as we have different stimulus to our arousal, which is this line up here, we're going to talk about, okay, that ventral vagus nerve is really responsible for putting us into that parasympathetic tone where it's joy, safety, groundedness, compassion, mindfulness. If we don't feel safe, right, we're going to go into that fight or flight mode, the sympathetic tone. And then we also see the dorsal part of the vagus nerve actually puts us in that complete immobilization phase. So I like to take freeze out of that. It's, I found this graphic on the internet and I like it. However, you can have freeze in your fight or flight mode as well. But this freeze here, we're talking about immobility. That's the actual immobilization, inability to actually mobilize your physiology. And that's where pathologically speaking, right, we'll give a child a pacemaker if they have a dorsal vagal or a ventral vagal lesion, right? So if there's a lesion on the ventral vagus nerve, which means it's not working, then that dorsal vagus nerve is overactive and we can actually be at risk for our heart to stop. So that's a pathologic version. We're talking about a healthy person that's out of balance here. So again, kind of going into that three primary circuits that provide your regulation of your autonomic state. Which state are we in? That ventral vagal is that social engagement behaviors. Your dorsal vagal is immobilized defensive, and sympathetic is mobilized defensive. So we're fighting or flighting, or we're immobilized in a defensive realm. So through that coupling, we note that there's 5 states that can be associated with different classes of behaviors. In full safety, we have that social engagement. If we're safe in a safe environment, but we're mobilized, that leads to play, right? I'm wrestling with my dad, I'm wrestling with my brother, I'm, playing a sport, right? We're still safe, but we're mobilized, and we still have to be in that sympathetic tone. We're releasing those neurotransmitters and those chemicals to be in a mobilized defensive behavior, but we're still safe. So that's that coupling with the ventral and the sympathetic tone there. And then we have our fight or flight where we're not safe and we're going into defense mobilization state. We have that safety where we're unsafe, but we don't have that ventral vagus response. So we go into the immobilization or shutdown. And then we have that social engagement where ventral and dorsal are both actually operating together, where we can find the intimacy. So we've really calmed down to being immobilized and safe. So through coupling through the 3, you can really see how every state of being you're in life, including sleep, fits into one of those 5 categories. So I have a little video that I typically will show, because it shows how the ventral vagus nerve is actually responsible for the striation of our facial muscles. And I think it's just phenomenal to see. It's a really important video to recognize how early these skills are developed. Can you guys hear this okay? Can you hear the video?
And she gives a greeting to the baby. The baby gives a greeting back to her. This baby starts pointing at different places in the world, and the mother's trying to engage her and play with her. They're working to coordinate their emotions and their intentions, what they want to do in the world. And that's really what the baby is used to. And then we ask the mother to not respond to the baby. The baby very quickly picks up on this. And then she uses all of her abilities to try and get the mother back. She smiles at the mother. She points because she's used to the mother looking where she points. The baby puts both hands up in front of her and says, "What's happening here?" She makes that screechy sound at the mother, like, come on, why aren't we doing this? Even in this 2 minutes, when they don't get the normal reaction, they react with negative emotions. They turn away. They feel the stress of it. they actually may lose control of their posture because of the stress that they're experiencing.
So as a mother, I can never watch that video without getting a little choked up, because I don't think I could ever do that with my child, is not respond. I use this as an example when I'm speaking to people with Parkinson's and their care partners. One of the main symptoms of Parkinson's disease is this masked facey that we call, where we lose that sense of facial expression. And it can be extremely validating for a care partner to hear that, hey, it's not all in your head that you're feeling this lack of connectedness, this lack of intimacy, right? On a very deep physiological level, we mirror the facial expressions of those that we love to regulate our own nervous system and find safety and intimacy in that. And from a very, very young age, our ventral vagus nerve is sending us those signals of, oh, you're safe, or no, you're not safe here. Mom, there's something wrong with mom. And I think in such a simple, small video, we can really understand of how, a whole different lecture series is the interconnectedness of humans, right? How we're meant to be connected beings and how our energy transmits and communicates with one another. But also how in dysregulation and being in a state of dysregulation, or a place of other people being dysregulated, our own nervous systems will recognize that, even if we can't, and go into a state of anxiety or fear or fight or flight or shut down without maybe understanding what those triggers are. Why is that happening to me? What are these known triggers? And to recognize that such a subtle shift in somebody else's regulatory function of their nervous system can set yours into a state of dysregulation is really profound to me. So I mentioned before, we have this vagal break. And the analogy I use here, if you're not familiar with me yet, the analogies and metaphors are vast and complex, but it helps, is that, if you're driving along in your car and you see the light turn to red, hopefully we're not stopping by just releasing the gas, right? We don't just stop our car by letting off the gas, and ideally we're not, because it leads to fender benders. And if you are, please stop. We have to press on the brake. We have to intentionally press on the brake to stop our car. And so the vagal brake is really this inhibition of the vagal pathways of the heart, which is mediated through the ventral vagus, which says we are actually going to stop our body from being in the sympathetic tone. So why is this important? We could cut our vagus nerve and still survive. Our heart would go fast, our eyes would be dilated, we'd be on alert all the time, we'd be sweating, we'd be nervous, oh wait, is that just adulting in 2024, right? Aren't we all living that way anyway? Our heart is beating, we're all having hypertension and arrhythmias, and we're just a little bit nervous and anxious, and we're never really stopping to breathe or calm down, right? Our vagus nerve is essentially severed in the adult population. I see this over and over and over again. And the reason is because we can survive like that. That can be our baseline. It's not sustainable. It's not healthy. And we'll learn more about that later. But in an effort to get into the parasympathetic nervous tone, we have to be intentional. We have to press the brake, which means we have to stimulate that ventral vagus nerve. And we're going to talk about how we do that later. I do want to jump into a quick tangent here on heart rate variability, because it has such a profound amount to do with what that means to be in an actual intentional state of relaxation. And so this is what a heartbeat looks like. I'm sure most of you have seen this on an EKG machine or somewhere, and we're looking at this peak to peak, which is called the R to R interval, and all the different waves that our heart goes through within a beat. Heart rate variability is the variation in time between those R waves. And so a healthy heart, we don't want it to be at a constant rate, right? Your heart's a muscle, it's electrically induced, we've got nerves going to it. We want it to ebb and flow with the change in our environment. We want it to go faster when we need to go faster. We want it to slow down when we're in a restful state. We really don't want it to be at a constant rate. We want there to be variability through that. And again, this is determined by those vagal influences. Are we safe or are we not? So when we're looking at heart rate variability, what we see is this peak and this valley. And again, this is not your heart rate. These are not R to R waves. This is the variability between beats. So we have higher variability between beats and then lower. And this is really what our heart rate should look like through the day. And interestingly enough, in the physiology, what we know this mirrors is your breath. And when your breath is in resonance, and we're going to talk about this for a minute, I'm just getting too excited and I'm too ahead of myself on my slides, but this is an inhale, this is an exhale, and we're going to come to that. But we know in a healthy state of being with a balanced nervous system, when we inhale, we go into the sympathetic nervous system tone. And when we exhale, we push on that vagal brake and we go into the parasympathetic nervous system and we increase or decrease our heart rate. And then we increase our heart rate and we decrease our heart rate at a constant rhythm that's called resonance. And that it should, ideally in a perfect world, mirror our breath rate. So again, that inhale gets an increase in our heart rhythm and exhale is a decrease in the rhythm. We already know, because we talked about it earlier, that in and of itself is 80%, or the large part of 80% of the pathway to the brain that stimulates the vagus nerve, right? I've already mentioned that. Sorry, I had a chat come up. Oh, somebody said my audio is intermittently cutting out. Is that happening for everyone? No? Okay. That might be an individual connection. I'm sorry for that. I would try to check back on the video on our website. It should be posted within the week. But again, those are those vagal influences that shift the increase or decrease in our heart rate variability. That has been shown, and you can go on a website called heartmath.com. It's actually phenomenal. And they really study this heart rate variability down to the biochemical, physical, or physiologic level, and talks about it's not enough to just be relaxed, right? Like I tell my patients, it's not enough to just sit on the couch in exhaustion and say, okay, I'm parasympathetic now, right? I'm in the rest and digest phase. Chances are, if you're sitting on the couch out of pure exhaustion, you're more in the immobilization stage of the sympathetic tone, right? You're like, I just can't do anymore. And so it's an intentional way of being in the parasympathetic state, and having a positive emotional state, specifically gratitude, has been shown in the research to elicit this resonance between your breath and your heart rate variability. And so this coherence or resonance that we're looking at is the development of a smooth sine wave-like pattern in the heart rate variability trace, a greater emotional stability with increased mental clarity and improved cognitive function. Oh, now I get why Dr. Karin, the memory doctor over there that deals with neurologic stuff, is talking about heart rate variability. And it is not equal to relaxation, right? We want to be calm and balanced, yet you still want to be energized and responsive. That's the dream, right? That's what everybody's looking for. I don't want to be wiped out just because I'm, exhausted, and consider that relaxation. It's an active state of being to be in coherence. And you can see in this graphic over here, as your respiration rate is increased and all over the place, your heart rate variability is going to be variable as well. And when we come into coherence, you can see that respiration rate smooth out in that sine wave pattern. And then so does your heart rate variability. Again, this is not heart rate. This means that your heart rate is actually changing and that it's being variable during this coherent state. Is this making sense? Ron, go ahead.
I have an Oura ring that measures heart rate variability.
Yeah.
And is the number a high number or low numbers? Which one's better?
We're striving for a higher number. So a low number of heart rate variability means there's not much variability between your heart rates. So you could always be at a high heart rate or always be at a low heart rate, but we're not oscillating between the two. So the higher number you have, the more variability you have in that sine wave to say sometimes it's high and sometimes it's low. And that's what we're looking for with heart rate variability. Keeping in mind that that's only looking at your heart rate. It's not looking at your respiration rate to find that coherence.
Okay, so like my rate was 41. Is that like
That's a really great number. Yep.
Okay.
My goal for people who are tracking that is to stay out of the teens. And I'm sure you've seen in your Oura ring too, some people say if I have wine, I sleep great, but my heart rate variability is, sucky. If I'm getting ready to go to Thanksgiving dinner with my family, my heart rate variability will drop, right? And that those certain things are going to shift your heart rate variability. And that is, we don't want that to drop. What a higher number is better. And so you can start tracking on your Oura ring, hey, what increases or decreases my heart rate variability? And can I find that trigger that affects it? We
Good,
already
thank
talked
you.
about, oh yeah, of course. We already talked a little bit about coherence and relaxation. They're not the same thing. Here's the foot on the brake picture to say we can't just coast in and assume that our body is in a relaxed state. As you can see here, in a relaxation state, we're not in coherence. We're just low. And in the appreciation state, that's where we're finding that coherence. So when we find that sweet spot, that's called that respiratory sinus arrhythmia. And that's when, as you can see, somebody who's in coherence is having this respiration rate, which is the blue line, inhales and exhales, marry up with their heart rate variability. So we have an increase in variability between beats, and then we have a decrease, and that's fluctuating as we get into that coherence with your respiration rate. Fun fact is really we should be respirating at a rate of about no more than 10 breaths per minute. And oftentimes people say between 6 and 8. On average, people are breathing 14, 16, 18 breaths a minute. That's hyperventilation. And while you're not sitting there going, what you're doing is shallow breath work, really only using the upper lobes of our system. Our posture is this because we're over our computers and our phones all day long. And so we're not even using that diaphragm to pull our lungs down. We're not getting the air into the exchange in the alveoli in the bottom part of our lungs. We're not even utilizing our whole lung space. So of course we have to breathe faster. We're only using a portion of our capacity. And when we start to shift and increase awareness on our breath to how it affects our nervous system, those things will all shift and change with you. And before we get into that, really the empowering part is I want to introduce you to a couple more definitions because this helps tie in, okay, there's the physiology of it. Now, how do I know? What does this look like? How does the communication pathways exist? So interoception is a really fancy word to say, what are the conscious feelings and unconscious monitoring of the bodily processes by the nervous system? So we have sensors in our internal organs to evaluate the internal conditions, what's going on. Let me have some awareness. It's going to send signals from those organs to the brain. That brain then, right, the motherboard who we blame everything on is going to interpret that information and regulate the organs accordingly. Hey, you got this, you're feeling emotional, or I'm sorry, you're feeling inflamed. Here's how we're going to regulate that. We'll give you diarrhea. We'll do something different to address whatever sense you gave me. And that's that motor pathway that go from the brain to the organs. So interoception is a communication within your body. I have a stomach ache. I don't feel right. These are the things that I'm sensing. I'm going to tell the brain about it. And then the brain is going to then process the information and send a signal back out to those organs to do what they need to do. Now, again, if you think about the paradigm of medicine, what are we treating? We're treating that end result, right? Oh, you have this symptom, let's treat it. Mask it, suppress it, get rid of it, whatever that case may be. Now we know that emotional intelligence of our body, that symptom is really the final manifestation of this giant communication pathway that started much earlier with them saying something's wrong. I'm going to tell the brain, and the brain responds by compensating by giving us a symptom. And now as physicians on the grand scheme, we're just saying, shut up, symptom. Instead of saying, well, why did you send that signal? What's happening in there? Why did the brain respond in this way to compensate for what you were communicating to it? And so really that's a lot of work and deep diving, but that's one of the foundational principles of naturopathic medicine is what is the root cause? What are those communication pathways trying to tell us? The other term that I want you to be very familiar with, especially as it applies to the nervous system, is neuroception. And I use this graphic a lot because in my practice, I'll use the analogy of, we've all seen war movies or ship movies or something like that, right? We have the radar going all the time and it's beeping at you, beep, beep, beep. Neuroception goes on 24/7 in our subconscious being. It is informed by previous experiences, of course. There's always going to be bias in our neuroception. We only know, what we've experienced or been taught. However, that radar system can be dysfunctional if it can't discern the difference between a canoe and a pirate ship, right? If your radar system is out there and you're supposed to recognize whether you're safe or not, but because of previous experiences, traumas, what you've been taught, anything in your life, it has difficulty discerning, okay, is that a canoe? Is that dangerous? Or is that a pirate ship? I'm just going to beep at her. I'm just going to keep beeping. You're in danger. I think you're in danger. This doesn't feel right. I don't know what it is. So we're going to beep at you. And really what we know that as is that gut feeling, that intuition, right? I used to fly jets for a living in the military. And after all the millions of dollars they invested in us and the equipment and everything else, you know what they told us? If it doesn't feel right, stop, land the plane. The little hairs on the back of your neck go off, be done. So military trained aviators with all of this information, they know and are taught that something in your body, this neuroception, if it's saying it's not right, there's enough external triggers that are adding up that we might not be aware of yet that say this isn't safe. Now, of course, it cannot always be accurate, right? People with a very immense childhood trauma, a trauma history, people who have neurologic damage can have miscommunicated neuroception or signals, right? Their canoes could be miscommunicated to them as pirates. And so they're responding in this extreme state of unsafety or danger all of the time. But in a healthy, balanced individual, right, we get these cues of safety and danger, and that's really what keeps us alive and thriving. It's that sixth sense, if you will. So we really want to sense that, you know, how we can do those social engagement behaviors, building relationships. You know, how many times you go somewhere and you're like, oh, you got a weird feeling about that person or that environment, right? It's not always biased. Sometimes it can be biased, but a lot of times it could not even be the person. It might have been the paint color in the room. It might have been the song that was playing on the jukebox while you met them that was triggering of a previous trauma that your subconscious is like, I don't like this song. Remember when this song was playing? We got diagnosed with this. Remember this song was playing and mom died. And that song could be playing in the background when you meet somebody and automatically, I don't think I like that person. Right? So it's not always accurate, but it's accurate in the sense that it knows what it knows from your experience. And that's a really powerful thing to be aware of, because now we can start to dive into, why am I feeling the way that I'm feeling? So again, I want to come back to, safety does not equal the removal of threat, right? It's how we orient when we're in a situation that is giving us signals of danger. And so it's depending on the three conditions. You cannot be in a state that supports defense and feel safe. Your social engagement system has to be activated to downregulate your sympathetic nervous system. That's that vagal brain. You actually have to be activating that. And then we have to be able to detect cues of safety as well as danger via the neuroceptive pathways. And we have to be able to recognize them. Right. So I like to share, I'm very transparent about that, is after my time in the service, I had difficulty with some panic things and triggers, and I didn't really always understand what it was. And sitting alone in a room doing breath work didn't work for me. I couldn't feel safe. I couldn't downregulate. I couldn't get to that place. I had a dog, though, that my husband knew if I bring my dog to her, she's going to sit with this dog and everything is going to balance. And when you can recognize what your safety cues are, what are the things that help? What are the things that actually downregulate you? What is the active participatory plan that I can have that I know is going to downregulate my nervous system? Now we do a little bit better at that component, rather than just assuming sitting and breathing and being quiet will fix it, will downregulate. Adrian, do you want to share your story? You put it to everybody.
Yeah, it doesn't matter. When I was a kid growing up in Anchorage, they brought a circus up where they had Yogi Bear and Boo Boo Bear characters in those big character outfits come out. And what happened is that all the kids in the audience actually reacted as if they were real bears. So I remember my brother, who is 4 years older than I, pushing me behind him. All of the older kids got in the front. They pushed the little kids in the back to kind of protect them. It was really interesting, and I think it kind of threw the circus people off. So they got rid of the Yogi Bear characters pretty quick.
Especially in Alaska, you would think bears probably are a little triggering for folks.
Right.
So,
when you were talking about the neuroception, that's what it reminded me of, that story.
No, it's good. Thank you so much for sharing. It is. And I think most people, when they hear that and then they hear the safety part, is like, it doesn't mean it's a removal of threat. Like you have to consciously know how to push that vagal brake to downregulate.
Right.
Most people can think of a scenario in their life. They're like, oh, That's why that happened. That's why that continues to bother me. It's really interesting. I have a family that I care for in my practice, and it's 3 sisters, and I nickname them Fight, Flight, and Freeze. And under stress, they all have a different stress response. And so each of them come in and talk about what's happening. It's okay, well, you're in your flight mode and you're in your fight mode and you're in freeze mode. So obviously it doesn't work together for the 3 of them when they're all in a heightened state. Really quickly, we're going to go through this. I think it's really applicable to anybody on a health journey, just to really understand, as we're talking about our nervous system and orientation and what safety looks like and intentionally being well. Now we're going to come into, what is the placebo effect? We talk about it all the time. I joke often, it's been ruining, therapeutic research papers since the beginning of time. I love it. I embrace it. I just told a patient the other day, hey, we're going to do this. I believe 100% in the therapeutic benefit of this medicine, but I need you to as well, because it's going to enhance your prognosis. It's basically a beneficial effect produced by a placebo drug or treatment. It's not attributed to the properties of an inert substance. It's due to the person's belief in the treatment. And it's actually more than positive thinking. We know, and this is an old paper, it creates a stronger connection between the brain and the body and how they work together. So if you're taking a new medication, if you're trying a new therapeutic, if you're trying a new body work, and you actually believe that it's going to work better, and you are intentionally safe in the environment in which you take it, it's going to work better. And now we know that there's an actual biochemical link to that, is because your body is willing to receive it. We're down regulating our fight or flight mechanism. We're able to upregulate receptors or digestive processes, enzymes, everything that we need to enhance our physiologic well-being. And now we're going to get more therapeutic benefit. Like it's becoming more and more and more, not just the placebo effect, but an actual biochemical response to how we are when we take our medicine. And my mentor, Lori Mishley, just talked about a paper that was published that said, when people take their medicine in a ritualistic form, right? When we give somebody an intranasal spray, say, so there's an intranasal form of glutathione, and you say, prior to taking, you need to lay down on the couch and you need to be in a calm state and take deep breaths. And afterwards, you need to continue laying there. You're going to get better therapeutic effect from doing that whole ritual around it than if you just spray it up your nose and go on your day. And it's not just due to gravity, right? If you're going to go take your medicine, or you're going to take your supplement, or you're going to eat your food, which is medicine, and you sit down and you show gratitude or prayer or thankfulness, and you are really mindful about it, and you put yourself in a state of being for absorption and digestion to happen, you're going to get better benefit from the food. And so it is a biochemical relation to how we are in our nervous system to how we are physically. And the opposite can be said for the nocebo effect, right? That's your evil twin. If you think it's going to happen and you're in that fight or flight state and you're fearful of the side effects, you're more likely to manifest those. You're more likely to experience those. And do those mean they're not real? Absolutely not. I mean, this goes all the way down to the condition called Munchausen's, right? If we believe so strongly that we are ill, we can actually manifest the symptoms of that disease physiologically, and they will show up, even though the initial pathology might not be there. And so it goes all the way back to when we're talking about high variability, with that gratitude and that resonance and that state of being so important to how we respond to our therapeutics as well. Last but not least, if you've ever been a patient of mine, I am that person that's going to stop you mid-sentence and say, what did you just say? Did you say, I feel sad, but I need to keep moving on? This is hard, but I got to push through, right? Neurolinguistics is the branch of linguistics that deals with the relationship between language and the structure and functioning of the brain. So how you speak out loud, and even more importantly, how we speak to ourselves, matters. You are a whole third person in there in your nervous system that says, she good? She's safe? Do we need to fight, flight, freeze? What is she saying? You're stupid, you're fat, you're ugly, this is not right, you sound silly. What kind of self-talk are we engaging in that's actually causing our nervous system to be in a state of dysfunction because it doesn't feel safe with yourself? And so the fake it till you make it mantra, it's real. It's real. You practice it. Get involved with creating a relationship with yourself that is more of gratitude and appreciation, and your physiology will respond. And so we've learned all about why. Now we're saying, hey, words matter. This can be hard. and you can be grateful for your experience at the same time. Right? Both of these things can exist. And when we start to witness and honor that interoception, those signals that your body is giving to your brain saying something's not right, this is how we honor. Hey, I hear you. And while my brain's going to say, I'm going to give you a stomach ache, or I'm going to give you diarrhea, or I'm going to get your immune system going because something's off, I'm going to give you a fever, right? As that's happening, we can create that deeper level of awareness to say, I'm listening. What's off? What's up? What's happening? Are we in a state of safety? And so often I hear I'm too hard on myself and these really, really negative self-talks. And I'll pause right in the middle of a visit and say, we really need to work on that programming because your nervous system is listening. And how can you ever expect to feel safe in any environment if you're not safe within your own body and your own narrative? So really the key point here is, what if it's not all automatic? Right? The initial definition of the autonomic nervous system, this is automatic. This happens without conscious control. Remember that bolded piece that was back on the side, that without conscious control. But what if it's not? We already know now that, again, the majority of 80% of the afferent fibers coming from the body to the brain is what happens, is what signals the brain puts out to the body of how to be. And so if we know breath work and we can take that one physiologic shift that is so profound, and we know if we shift our breath pacing and how we're breathing, you're breathing anyway, you might as well make it work for you. And we know that we can shift that pacing to put the vagal brake on and stimulate us to be in the parasympathetic nervous system. Even if you do 3 to 5 breaths, not even minutes, every hour of the day, you can create a new neuronal pathway that's going to keep you in a stress response and then elicit these healing mechanisms, reduce inflammation, move to healing, improve digestion, absorption of nutrients, and reorient your nervous system to its triggers. And when we can do that, then we can start to parse out what are my triggers? Is it that song? Is it that smell? Is it this, what is it in my environment that's putting me into this way of being? And we can start to have much more control over how we are, how our nervous system is, which then leads to our physiology responding in kind. But as I've said multiple times, the nervous system doesn't equal brain. And in this situation, even more so, that poor brain is over just going, I'm just getting the information. Don't shoot the messenger, right? You're telling me what's going on, and I'm relaying that information back in the best way I know how. So what is it about your environment or yourself that's contributing to your body feeling unsafe, right? We know now that's not a boo-ah, that's a I feel unsafe. That's giving those signals to the brain, causing it to then reciprocate with, hey, you need to fight, flight, or freeze. You need to get out of this situation. So the 4-7-8 breath pattern is something that Dr. Andrew Weil really, I don't want to say patented, you can't patent a breath pattern, but perpetuated on his website and in his practices. And when we inhale for the 4 through our nose and we hold for 7, and in the hold, I've started to drop your shoulders. Everybody who holds their breath goes like this. So hold in a relaxed state, and then you're exhaling for 8. In, hold. Within the first 3 breaths, people will completely shift how they feel in office, in front of me. And that's just one time. If you do this every hour of your waking time for a month, I will guarantee and bet my license, and I'm being recorded, that you will improve in whatever symptom picture you have without any other changes to your being. Is it a cure? No. Is it a better orientation to where you are in the world? Absolutely. And it can lead to more healing after that. Without addressing this in your medicine, in your therapeutics, in your protocols, in your life, we're missing, in my opinion, the one key part of how we heal. And that's, how are we? How are we in the world? How are we orienting? How do I have more control over my own physiology that's thought to be automatic, when I can actually hijack the system and put myself into a space of safety? I really want to highlight Dr. Brad Lichtenstein. He was my mentor in school who taught us all about biofeedback and the polyvagal theory. I'm going to be honest, when I was in medical school, I was like, give me the herbs, give me the meds, teach me how to fix people. And so in his lectures, I was like, breathing, like, come on. And then I got into clinical practice and I'm like, breathing, come on, everybody, breathe. You're already doing it. You're already breathing if you're alive. And if you make it work for you and you can enhance everything in your being, I don't see why we wouldn't all be doing this. And so he has a website, it's thebreathspace.com, www.thebreathspace.com. And I'll put that on the chat box here in a minute. He has free Take 5 breath awarenesses. He talks about, how to do this. You can schedule an appointment with him. He's a phenomenal practitioner. But really that's, this really where we need to be going, in my opinion, because I describe the sympathetic nervous system tone to people about running from a bear. And then I'll kind of get the giggles. I'm like, well, that's how everybody is right now. That's how we're all living. And so breathspace.com, put that in the chat box here. So I've got about 5 more minutes here before I have to sign off, hard stop. So any questions? Anybody have any questions, concerns, comments, thoughts, revelations? Seems too good to be true, right? It's like this, it's too good to be true. But you dive into how your body works and what's happening. And so often in my practice, I'll say it's intention and attention. And if we're living our life, really, Mary Oliver has this beautiful quote, right? Like, listen closely. What is it? Are you living a life and just calling it breathing? It's something beautiful that just, are you actually living your life, or are you involved in it? Are you aware of it? I feel like Thomas might know that quote. Are you breathing a little and calling it a life? Is that what it is? Either way, are we intentional and attention to our breath and to how we are in the world? And can we improve that? Or are we just existing at the very cellular level? We weren't meant to just have our hearts beats and our lungs work and just exist and then do all this other stuff on top. We still need to pay attention to how we're functioning. Yeah, go ahead, Adrian.
If you were to recommend a next step, a reference, a book, some way for someone to learn more about this and to follow on this, what would it be?
It honestly would be Brad Lichtenstein. That is his primary focus of his practice. He does biofeedback work, counseling, trauma. He's phenomenal. He is, in my opinion, the guru of the polyvagal theory in a practice, and that's his primary focus. So really, really a great resource to reach out on his website and schedule a consultation with him. For really quick glimpse, I love the website heartmath.com, because it's trying to sell a product for, essentially doing biofeedback, but in it cites all of the evidence and how things work. So it's a quick overview of information. If you really want to dive in deep into the weeds, it can be a little bit dry, but you can pick out things on that. It is going to be the Polyvagal Theory by Dr. Stephen Porges. That book, if you just look through the glossary, it'll go through all the definitions of all the things we went through, and you can kind of start to piece that together. And then in the book, he kind of talks about how he came to his theories and things like that, which is phenomenal. The recording will be posted on the website within the week. And if you go to our website, cdahealingarts.com, events, and then I think you scroll down to open forums. If you have troubles, you can call the front desk staff exactly how to navigate it, but it's on that website. And then the first reference was Brad Lichtenstein he's a naturopathic doctor, and he's the breath space. I'm going to write this down, is www.breathspace.com. If you want a copy of the PowerPoint, you can email us at info@CDA Healing Arts, care of me, and I can email you back with a PDF version of the PowerPoint. This is privileged information, though. I made these slides. It's all my information. It's my brain, so I do ask that you don't share that or distribute it anywhere else. It's for your information only. And I'm going to go ahead and shut off the recording here, and we can keep chatting.